Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Good morning.
Morning.
What I'm asking about today, and I won't go into a lot of history. You can ask me about history just to, so it doesn't get long. What I'm trying to do to pretty much get rid of possibly arthritis pain, but it seems to be my whole body. What I've been doing is trying to get onto CBDs instead of ibuprofen. Um, And I just need I just I just don't know what's typical. Like I take let's see, a 25 mg CBD in the morning, and it does take the edge off. But I do find that I don't know how soon again to take one, or I've been doing it for 2 weeks and kind of, seeing what works. But I find that, if I take one at 8 in the morning, um, then I'm still not, feeling all better by 10 o'clock when I have to go out and do things. So I would take a dose of ibuprofen. And then for most of the rest of the day, I'd be okay. I did try the first time I took it. I tried taking it before I went to bed, and my mouth was really dry. And I woke up in the morning, and my whole eyes and even the bridge of my nose was all swollen. So I did read somewhere that it could have affected that. So I haven't taken any at night. So I was just wondering, how long do they typically last? I mean, any kind of typical advice you can give me instead of me experimenting.
So if we understand you correctly, you're asking if you can replace the use of NSAIDs, which is the ibuprofen, the class that ibuprofen belongs to, which has a fairly fast onset. Usually people will say it works within 30 to 60 minutes in terms of reducing pain.
Right.
Where now you're looking at other alternatives, and you specifically mentioned CBD. Is that correct?
Yes, yes. I want to, I'm trying to help improve my diet and everything else. And I thought I should improve this situation also and get
Yeah.
away from them. Yes, I'd
For
like
sure,
to.
yeah. I think there's a lot of reasons to do that. The two main ones with this class of medications is the effect on kidney function long term, and also the effect on the lining of the digestive system.
Mm,
Ibuprofen, Aleve, naproxen, these are in this family of medications. The first one actually, kind of aspirin, and we know that they do inhibit the repair of the lining of the digestive tract, and it can cause damage. It can cause ulceration if it's used long term. Now, there are some people that use these medications long term, months and years, and they don't have any impact on your gut. But generally, the stronger the medication, like for example, a naproxen, a naproxen is the one name that you might be familiar with, is stronger, and so it's often given with medications that actually help protect the lining of the stomach, like acid blocking medications, which have a whole bunch of issues in their own right. But I think you're wise to start thinking about looking at other alternatives. I can just share with you, based on my clinical experience, CBD does help with pain, but it does it in a very different way than something like an ibuprofen. It's not going to work in the same acute way, like I'm going to use it before I go out. I think it's one of those things that people are using to decrease pain overnight. They're using it to help decrease inflammation. And you're going to have to kind of play around with the dose with the prescribing doctor with the CBD. Sometimes in the evening, there's a little bit of a combination of THC and CBD to help if there's sleep issues. I think it's one of those things that you kind of patients will layer on first, the both of them together before then removing and reducing. The same principle applies to using natural health products, where people might use something like a turmeric, a ginger, curcumin, boswellia. These are 3 common anti-inflammatory botanical herbs, and you implement them, and then you observe the effect on pain and inflammation, decrease the amount of medications you're taking. I think the approach can be taken the same. So there isn't a perfect formula to say this is the amount of CBD you should be taking to decrease and cover off the pain, because that's very individualized.
Hmm. Is it one of these things where you're better off like taking it, all day and all night, or is it or is it okay to take it, in the morning every day and or
Yeah, so I think you want to use the CBD consistently to have the anti-inflammatory effect.
okay.
Uh, Generally, the body does kind of adapt to the use of CBD long term, like every day. So what that means is just it becomes less effective over time, in my experience. But that doesn't mean that it shouldn't be tried. The idea is to try to get the pain in check over the span of 2 or 3 months, and then use less and less of it, and that'll kind of maintain its potency, or use as needed, and maybe use the NSAID, the ibuprofen class of medications, also as needed. As needed is a better approach than every single day in terms of safety on the ibuprofen front, but some people do need to start with being consistent with them daily.
Hmm. No, I don't know if I misunderstood. Would you? I not. I mean, what have you noticed in literature and stuff about? Did you say that you've noticed that if you start with the CBD and a little THC, and then after a while reduce the THC, or did I misunderstand?
Yeah, so the THC is going to add a little bit of that
Oh,
more psychoactive effect. And
right.
so you're going to, and that does have more of an impact on things like sleep. Some people do need to have a little bit of that THC. You can get pure CBD that lots of patients will say really helps with their pain. So there's that. Some people will say actually smoking or vaping cannabis helps with their pain because they are getting both there. So what we're talking about is just straight cannabidiol, which is CBD.
Yeah, that's what I'm trying. Okay. I got one real quick thing. I'm excited. I live in Buffalo, and I found an acupuncturist that does the needles in the muscle with the electrical stimulation. I know it's common in Canada, but I was pretty excited to find it in Buffalo. So I don't
Cool.
know.
Yeah, I mean that's called electro-stim,
Y-
and you're basically amplifying the effect of acupuncture by attaching a
Mhm.
therapeutic current that runs between 2 or multiple points on the needles, and it can be quite helpful to address myofascial pain, which is a large proportion of neck related pain. Now, we always warn acupuncture in general can be stimulating, so start gently, and this is hopefully something that can be conveyed to the provider, and or they just generally know that this themselves. Start gently just to gauge how do you respond to acupuncture, and then they
Mhm.
can progressively increase the stimulation, because acupuncture and then adding electro-stimulation of that acupuncture is going to be something the autonomic nervous system does still have to process. So it is an autonomic stimulus in
Mhm.
that
Mhm.
sense.
Yeah, yeah. He started real gradual with just
Good.
yeah, and yeah, progressive. Yeah, I've only been there 4 times, but I'm excited, and it's at
Good.
least we
Good.
get a little bit of what's in Canada.
I'm
Yeah,
glad you find it.
yeah. Okay. All right. Thank you.
See you.
Thanks.
Thanks for listening to this Concussion Fix minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.